Good morning and welcome to the July 30th COVID-19 briefing. I'm Megan Pearson, your Chief Communications Officer, and today I have with us our Chief Administrative Officer, Ryan Alsop, our Director of Public Health, Matt Constantine, the CEO of Houchin Blood Bank, Brad Bryan, and our lead epidemiologist, Kim Hernandez. I'm going to start with our latest information about testing and a brief conversation about our surge site out at the county fairgrounds. So we currently, just between the county sites and the federal site now, have 35,425 tests completed. And the surge site was opened yesterday with the actual official launch happening today. If you're interested in going there, remember it's completely free. You can book an appointment online, although you do not have to have an appointment, and it's a drive-through only. They'll test any age, so if you have children under 5, which is a little bit unique, that you can take them there. If you're interested in getting a test there, the address that you need is doineedacovid19test.com. That information is located on the county's website as well with all of our other testing sites, but you can go directly there if you'd prefer. I do recommend that you schedule an appointment if at all possible and print your voucher. It makes the process go much faster. We did see a high number of individuals with drop-in appointments yesterday. It's a great asset to the county, as if you don't have internet access or access to a printer, it does give you the ability to still get a drive-through drop-in appointment. So we're excited to see that. It did have some high traffic yesterday, and we're eager to see what it pulls the next few days. That site does have a faster turnaround with results than most of our local labs. They're actually using a lab in another area that's able to process those a bit faster, so you should see results within 3 to 5 days. Again, that information is located on the county's COVID-19 testing page. If you're interested, I would recommend an appointment, but again, if you don't have internet access or a printer, they can still accommodate you. And with that, I'm going to turn it over to our Director of Public Health, Matt Constantine.
Thank you, Megan. This morning we are announcing 1,067 new cases in Kern County and unfortunately 4 new deaths. Megan mentioned the new federal testing site. I just want to acknowledge that that site is made possible by Kevin McCarthy. He has been very helpful in obtaining this resource for us. The Congressman has been talking to us and helping to coordinate activities. The objective is to test 60,000 people within the next 12 consecutive days. That is a tremendous resource for us, and we're grateful it is here. Megan has also mentioned previously the establishment of a mobile testing facility. I just want to acknowledge again, this is something new for us. We are targeting our essential farm workers. This is a collaborative effort between Supervisor David Couch and his office and the California Farm Workers Foundation and Good Samaritan Hospital, who has again been gracious enough to contract with us to get this done. They started yesterday. They were in Delano. They're in Lamont and McFarland this week. So we're grateful that additional testing is accessible for some of our most essential Kern County residents. Also, on Tuesday, the board approved an agreement so that we were able to allocate ICU nurses into our acute care hospitals. This agreement allows for more than 80 ICU nurses to be placed in different hospitals, predominantly in Metro Bakersfield, to increase their staffing so that we can increase bed availability, specifically ICU beds. That process is underway. We're hopeful we'll have some of those local nurses here soon. Also on Monday, the governor announced the allocation of $7.1 million to Kern County to be used for COVID efforts. They've identified 4 strategic areas. We are working with the state on how that can be applied and how it would be used locally and how it could benefit us in Kern County. There's a couple-week process where we're going to have some conference calls and meetings to talk about this with the state, but that is evolving, and we're hopeful that additional $7 million will help us with some of our efforts in Kern County. Also, we spoke recently too about our local hospitals and their request to the state for additional staffing. Delano Hospital, Adventist, Bakersfield, and Memorial have all been successful in working with the state, and the state is allocating staffing into Kern County at those 3 locations. Each team is made up of about the same configuration. They have registered nurses, paramedics, and either doctors or a respiratory therapist that will be allocated for 3-day periods of time in each one of those locations, and it can be extended another 3 days if the need is there. So we're grateful again that these additional resources are coming in locally to be able to help. With that, I think I'll turn it over to Ryan for his discussion. Thank you.
Good morning, everybody. Today in Kern County, we've tested nearly 125,000 people for COVID-19, and to date, we've got 18,411 residents who have tested positive, 18,052, or 98% of whom have either fully recovered or are currently isolated and recovering at home, treating their symptoms on their own. Today, we have 220 residents representing about 1% of the total number of positive tests to date receiving some form of care in an area hospital. Unfortunately, we've lost 139 people since the beginning of this virus's spread in our community, and that represents just under 1% of the total number who have tested positive over the course of this pandemic here locally. On hospital beds, we currently are reporting 475 regular hospital beds that are available throughout the county, with 30 available ICU beds. On Tuesday, the Kern County Board of Supervisors initiated a number of actions related to COVID-19 in our community going forward. Most importantly, the board initiated a plan to utilize federal CARES Act funding to increase ICU capacity in local hospitals by adding 40 additional beds beyond the current licensed limit. This action increases ICU bed capacity by nearly 18% from the current 232 licensed ICU beds. With this action, the county will spend $12 million to contract with Right Sourcing Incorporated for up to 84 additional nursing personnel that will be needed to staff these additional ICU beds. I want to thank the city of Bakersfield, who is a partner with us, with the county in addressing this critical need. On Tuesday, the board also authorized use of federal CARES Act funding for a county-wide public communications effort that will focus on reinforcing public health best practices and directives among county residents and businesses. The critical need for donation of convalescent plasma will also be a focus of this effort. This is going to be a coordinated communications push by the County of Kern and the City of Bakersfield for the next 6 months at least, and the effort is going to be led by Kern County's medical community, hospitals, their CEOs, and doctors. And I want to thank all the area hospital administrators and their chief medical officers, particularly Charlotte Briggs of Adventist Health and Russell Judd of Kern Medical for their leadership in this effort and many other efforts. A little bit on the Kern Recovers program. This is a program that involves a forgivable loan program for small businesses, as well as a PPE or personal protective equipment distribution program for small businesses. On Tuesday, the Board of Supervisors allocated an additional $5 million to the county's forgivable loan program for small businesses, which brings the total amount of direct financial assistance being made available to small businesses throughout Kern County to $30 million. In just 2 months' time, financial assistance has been distributed by the county to well over 800 local small businesses across 240 industries here in the county. To date, nearly all of this $30 million has been spent, and in the weeks ahead, we'll be considering how we may be able to do more. That is a priority of our staff, and I know of the boards, and in the weeks ahead, we'll be contemplating how we expand that program further. On PPE, personal protective equipment, as part of our Kern Recovers program, as has been mentioned, we're distributing PPE to small businesses. We're spending $5 million, targeting up to 5,000 independent small businesses for PPE distribution throughout the county at no cost to those businesses. We have 16 different distribution points throughout the county. Businesses can expect to receive a 2-week supply of quality PPE items. To date, 617 small businesses throughout the county across 69 different industries, representing a cumulative 10,626 employees, have received this free PPE distribution. 5,064 50-count boxes of masks, 7,475 bottles of hand sanitizer, 4,975 100 boxes of gloves, and 7,430 packages of sanitizing wipes. Small businesses, if you are a small business in this county, you simply need to fill out an easy application form and schedule your pickup. The turnaround time for pickup is 1 or 2 days in any of our areas across the county. You can find out more information, schedule your appointment by visiting kerncounty.com. A little bit on plasma donation. One of the most important aspects locally in medical care and treatment at any time, whether you're in a pandemic or not, is blood donation. It's always important to donate blood. Your blood donations save lives every day. During this pandemic, the need for convalescent plasma donation is essential. For those of you in our community who have contracted COVID-19 and have recovered, there are thousands of you. Please donate your plasma, please. Your donation will save lives for those in our community critically impacted by COVID-19. Be a hero and donate, please. The county is putting a strong shoulder into urging residents who've tested positive to give their plasma. In addition to all of the contacts already being made by our public health staff urging residents to give, the county has formed a convalescent plasma communications team that will begin an aggressive effort to do follow-back calls with those in our community whose plasma is most needed during this critical time. This additional effort will begin immediately. And before we begin answering questions this morning, I've invited Brad Bryan, our CEO of the Houchin Community Blood Bank, to join us to talk a little bit about this very important need. And I'd like him to come up and take the podium.
Hello, my name is Dr. Brad Bryan. I'm the CEO of Houchin Community Blood Bank here in Bakersfield. I want to thank you for hearing me this morning and listening in on this press conference. The numbers that were just mentioned are unprecedented. 17,000 cases of COVID-19 here in Kern County. 140, close to 140 individuals have died from this already, and we have over 200 people who are suffering from this and not able to treat this on their own. Of those 17,000 people, we've had about 130 people who have come into Houchin Community Blood Bank to donate convalescent plasma. Those 130 people have saved the lives of perhaps 300 to 400, 500 people, but there are still people in the hospitals. Every day in the hospitals, we are short perhaps 20 to 30 convalescent plasma units each day. And those are patients that we could get out of the hospitals, get back to their families, and back to their lives. Every one of us are impacted from this, whether this is you're a business owner, whether you're someone who has a personal connection to an individual who is suffering from COVID-19, or whether you are somebody who is just trying to stay safe and stay uninfected. We have an obligation, no matter where we are in there, to do something to help. If you're one of those 17,000 individuals that have recovered that are recovering or have recovered from COVID-19, you have an obligation. You have an obligation to your neighbor to come down to Houchin Community Blood Bank to donate your plasma and get people out of ICUs. Convalescent plasma, there's been a number of clinical studies. As I looked last week, there was about 9 clinical studies published. Every one of those were positive, showing that there's reduced mortality as well as a shorter time in the hospital for individuals that have COVID-19 transfusions. So you have a weapon inside your body, and that weapon is something that can save the lives of individuals that are suffering right now. If you are a COVID-19 recovered patient, if you're 14 days from symptoms, give us a call. Our number is 661-616-2504. All you need to show is a positive diagnostic test or an antibody test. You come in, it's a 30 to 40 minute process. It's absolutely painless. I make sure we hire very good phlebotomists, so you're not gonna have any discomfort. And I can assure you 100% of that convalescent plasma goes into hospitals at no cost to the hospitals here in Kern County. And that's right, there's no cost to the hospitals. This goes straight to them. It saves the lives of patients, and we don't have enough. Again, every day we need 20 to 30 extra convalescent plasma donations, and we just don't have it. The numbers are picking up. You guys are doing a good job. If you're sitting at home and you're wondering what you can do to help people, and you've been through COVID-19, you've been through this is something you can do. Let's all in this. Let's save some lives. Thank you.
Thank you, Dr. Bryan. Okay, we're going to switch to taking questions. We are changing it up a little bit today. We have a growing number of outlets who are continuing to join this call. And to accommodate those who simply have a question and need to get off to other stories and to get their information ready for their newscast, we're going to ask that each outlet, as you're called, ask your initial question. Once that question's been answered, we'll go on to the next outlet, and at the end we will come back for any follow-ups. That way everybody has a chance to get their initial question out, and then we'll circle back. So our first outlet is Valley Public Radio. I believe we have Carrie on the line, and remember it's *6 to unmute. Okay, we're going to go to the next outlet. Carrie, if you're there, we'll come back to you toward the end. Channel 29, I believe we have Tim on the line.
Hi, everyone. Yes, good morning. So my question is, Mr. Alsop referenced the amazing amount of help that's been given to a lot of businesses, whether it be loans, whether it be personal protective equipment. We've gotten a lot of calls from employees at various locations who are meant to be shut down under the governor's orders, but are refusing to do so. Now, I appreciate that you guys have always taken the stance that this is the state's order and therefore it's up to the state to issue any kind of enforcement. But I promised one of these employees who I spoke to just yesterday that I would ask you guys this question. This individual is a single parent, says they can't afford not to go to work, but is petrified to go to their job, and says they've tried to reach out to the supervisors, to individual representatives, to county public health, state public health, and they don't know what to do. They're at their wits' end. So I'm asking for some of these individuals, at what point can we put more pressure on the state? What can we do to address some of these concerns of our citizens?
Thanks for the question, Tim. We're going to have Ryan respond to that. Give us 1 second.
Thank you, guys.
Tim, I apologize. I was talking on the side. Can you just, right at the last, can you fine point your question just at the end there? What do you want me to comment on specifically?
Sure, absolutely. So to summarize there, I was talking to an employee yesterday who works at a facility that is meant to be closed under the governor's orders. And this individual says that they've reached out to various officials and cannot seem to get any help. She's terrified to go to work, and she feels that she doesn't know what to do, right? Her business is meant to be closed, but she has to go to work. She's afraid to speak out because she's afraid to be fired, and she wants some action from the county or the state. And again, I appreciate that you guys have always maintained that this is the state's order, so your hands are somewhat tied. But what do you say to that person, or what do you say to the business owner who is following all of these regulations, sometimes incurring extra costs in this difficult time, and there are some businesses that are just flaunting the rules?
Businesses need to be complying with the directives of the state, plain and simple, period. End of story. The state is calling the shots, and they're in charge, their public health team, and the governor. They are issuing the orders and directives and the guidance that businesses need to be following. We have seen a tremendous response among our business community and the people of Kern County to those orders. There are folks that are most places, the vast majority of places, are following the guidance as it is put out. We locally continue to have a education and communications posture. It's a very strong position and posture that we are taking to reinforce the state's directives and the guidance. We are doing that through regular communication with various businesses. We have received hundreds and hundreds of calls from folks like the person that you're talking about and others who may call in reporting about one thing or another not being in compliance with state rules. Where that happens, we engage with that business. And whether it's initially a letter or 2 letters, then it becomes a phone call, and it could be a physical visit from a local public health official, again, to make sure that that business understands the directives of the state and the guidelines that they should be operating under. People here need to know that the state, the governor's strike team, which is made up of a variety of different state agencies, all of whom have strong regulatory tethers to businesses in this community, they are watching Kern County. They are watching us. They are not only watching us, they are here. They are engaging with businesses here. And my advice to businesses, if you are operating outside of the state guidance, you should expect a communication or a visit from any member, any state agency member of that strike team. There are a variety of them. And I think that businesses operating out of the state guidelines are doing so at their own risk. Where our local communications fail, if they're repeated, then we reserve the right to make sure that the state strike team understands that we have done all we can to communicate, and that they are made aware that a particular business may not be responding. So that's the position we're taking. We are, again, focused on education. This pandemic is rough enough for the business community, and all of us having our economy closed down, businesses closed down, people struggling. The last thing that we want to do is go in and issue fines and tickets and strong-arm people. It's the last thing we want to do. Again, our communications efforts are working. For the vast majority of complaints and places that we have to engage with, we see behavior change following that communication. If it's not that initial communication, it happens after the next one. We have very, very few issues in this community where businesses are operating flagrantly outside of the guidelines of the state. So again, if you are one of those businesses in this community, you're doing so at your own risk, at your own livelihoods, the risk of your own livelihoods and the risk of your businesses moving forward, operating as you need to be, with regard to the fact that you've got strong tethers, strong regulatory tethers to the state of California that you need to be aware of and worry about when you're going about doing your business during the pandemic. Hope that answers your question.
Yes, thank you.
Our next outlet is Channel 17. I believe we have Bob on the line. Remember, it's *6 to unmute. Okay, we're going to go to the next outlet, and we'll come back if we need to. Next outlet is Bakersfield, California, and I believe we have Sam on the line.
Hey guys, how's everybody doing today?
Sorry, say that again, Sam. I think we've got you.
I was just wondering how everyone was doing. I'm assuming that we're all moving along as well as we can. Can you hear me okay?
We can.
Great. My question is more, I was just hoping that somebody could go into a little bit more detail about what the county is doing to get people to donate convalescent plasma. Could you tell me a little bit more about these teams that are making these follow-up calls, and if they've gotten started already, how have they been successful, do you guys think?
Yeah, thanks for the question, Sam. We're going to have Mr. Alsop respond to that.
Hi, Sam, and thanks for your well wishes. We are doing okay here. I hope you're doing okay.
Yeah.
Let me start by saying that we cannot force people to donate blood. This is a continuing business challenge. I think Brad would tell you of the blood bank, trying to convince people and incentivize people to come down and give blood during any time. It's certainly the same challenge that we have. I would say it's probably even more difficult with getting people to come down and donate convalescent plasma. So we cannot force people. What we can do is to put a significant effort into convincing people that it's the right thing to do. They are needed. The community is calling on them to come forward and assist. This is an unprecedented time. I think Mr. Bryan went through that very well and hit on all the right points. The county, aside from what Houchin is doing, Houchin on their own is doing a great deal of communicating and putting out information and asking people to come donate themselves. The county, through our public health department and our public health team, through the contact tracing process, we have contact with people who test positive. We are messaging in the strongest way possible to those people how they are needed and how they can donate their convalescent plasma. We're providing them with information. In addition to those things, we are getting ready to launch a fairly significant county-wide communications campaign that will have an element of that messaging in it. Again, this is a campaign that is being funded primarily by the County of Kern and the City of Bakersfield, but led by the medical community, our hospitals, our hospital CEOs, our doctors, et cetera. They will be also communicating the need for people to, and hopefully persuasively, the need for people to go in and donate their plasma. In addition to that, and I don't want to get into all the weeds, there's some legal stuff that's really quite boring. I don't want to bore anybody with that, but we are working on a plan to provide the Houchin Blood Bank with the ability to contact people who have tested positive. There are some HIPAA issues related to that, and we are working through that process. This is something that will be addressed at the point of testing. That will allow Houchin prospectively to reach out and do follow-back calls on their own with their staff, with the population of folks who have tested positive in our community. In addition to all those things, beginning Monday, we are forming a county convalescent plasma contact team. This team is made up of county employees who are involved with managing our employee health benefits. This is one of the most outstanding teams that we have in the county on any given day with the work that they do and the savings that they achieve for the county and the service they provide our county employees with medical help. That team will be, in addition to a lot of the work they're doing, setting aside a considerable amount of time each week going forward to focus on doing callbacks. We're going to be primarily focused on contacting those people who have tested positive to date, reaching out to them, following back, convincing them that giving their plasma is the right thing to do, and we believe that will have an impact. And I can think of no better group of personnel in the county, no better team to undertake this effort. It will be an extraordinary effort, and after some HIPAA training related to this particular pandemic and a little bit of other preparation, we will get started with that process, callbacks, beginning Monday morning. Hope that answers your question, Sam.
Yes, thank you.
Thank you, Ryan. Our next outlet is Kern Radio. I believe we have JR on the line.
Yes, good morning, Megan.
Morning.
My question has to do with the stats being reported by Kern Public Health and the state. I've been on the state's website and their portal and noticed a discrepancy between what the state has and Kern Public Health has on their dashboard. Yesterday, the state was reporting Kern to have 18,834 positive cases. Well, the county had us at 17,344, and this morning they have us at 18,421 on the county page. That's still a 1,500 to 400 case discrepancy. I was wondering what's causing that discrepancy and why?
We're going to have Kim Hernandez, our lead epidemiologist, respond to your question, JR.
Good morning, JR. As we have discussed in the past, the state counting of cases is based solely off of the lab result and the number of cases. In Kern County, they do not come onto our dashboard until we have determined that they are a Kern County case. We verify the information that has come across from the lab report and the report from the healthcare provider. So there is a little bit of that lag. We're looking at different elements. The state doesn't wait for all of that information to be double checked. For example, if they got tested in Kern County and we receive their report and we find out they live in another county, that case we then transfer to that other county. And to avoid taking cases off of our dashboard, we wait until we can verify that information, that they are indeed a Kern County resident, that all of the elements have been completed before it is put on the Kern County dashboard.
Wouldn't they be counted under the non-residents on the Kern County dashboard page then?
We'll have Kim respond, and then we'll go to the next one.
Right, so those non-residents do not show up in our total count. They get transferred over. If we can do that quickly, then we do not put them on our existing dashboard. There's a lot of them that are moving round and round, and so we're focusing our time on our residents. So some of them do show up in that non-resident count, but if they are intercepted before they end up on our dashboard, they actually flow to that county of residents right away.
Thank you, Kim. Our next outlet is Channel 23. I believe we have Tori on the line. Okay, we'll go to the next outlet. I believe we have Kern Soul on the line. Remember, it's *6 to unmute.
Hi, this is Elizabeth. Can you hear me?
We can, go ahead.
Hi, I was just wondering, This is kind of off of Tim's question. Have you guys heard of any of the state strike team reaching out to any local businesses to enforce state guidance?
So I think we've anecdotally heard that they're here. I don't know that we have specific reports of what they've done.
Okay.
Yeah, we do. We have heard that they've been here. I guess that's the short answer. We've heard that they've been here. They don't coordinate that with us, nor do they report back to us. So what we hear is just word of mouth from businesses.
Oh, have you heard from any businesses that they've reached out to them?
I think Ryan has a comment, so let me have him address.
Okay, thank you.
I just want to clarify, we don't always know every contact that is made by the state to area businesses. A couple of weeks ago, I believe, in a call with the state, it was mentioned that I believe at that time there were 88 different businesses here, and I'm not sure which industries. I can't remember. I know that quite a few of them were bars and restaurants. Were contacted by members of the state strike team. I believe the ABC. In addition to some others, contacts were made. Again, the governor has said repeatedly at his press conferences that their goal is to make this an education-based effort, reinforcing the guidelines that are put out, and that's what the state strike team has been doing. I believe that there were also reports that there are citations that have been given, more punitive measures that have been taken with regard to the business activity in other parts of the state, and we have not, we don't have any confirmation by any business or the state that that's happened here, but we do know that the state strike team is paying attention to what's going on in Kern County. We do know that they are here in Kern County and that they are engaging with businesses here in Kern County.
Thank you.
Thanks, Ryan. Okay, that was our last outlet. We had quite a few who did not come off mute when we called them, so I'm going to go back through that list quickly. Starting at the top, Valley Public Radio. Carrie, are you on the line?
Yes, can you hear me this time?
We can, go ahead.
Okay, great. Yes, so I want to talk about generally Governor Newsom really turned his focus to the San Joaquin Valley this week. Of course, sending all of this aid and these teams. Is there, can this be interpreted as a failure in local health policy? It's not just, I'm not just talking about Kern County, neighboring counties as well, but can it be interpreted in that way?
Let me see. I think we're waiting to see if Matt or Ryan are. That's a good question. So I think Ryan's going to respond to your question. Carrie, give us just a second.
Okay, thanks.
Carrie, no, we don't take that as a failure. Please, if you want to ask your question over or refine it a little bit, and I'll try to be a little bit more specific.
Well, I guess. No, I'm not sure. I do have another way that I want to reword it. No, thank you. I think that's it.
Okay, thank you.
Okay, the next outlet that we skipped over earlier was Channel 17. Bob, are you on the line?
Hi, can you hear me?
We can now. Go ahead.
I want to ask you about contact tracing. I heard from folks about people who had tested positive, who had recovered, but they said that they never at any point heard from county public contact tracers. And I'm wondering if that's because the county is just sort of overwhelmed with so many cases and such a relatively small number of contact tracers, or perhaps physicians are not reporting to county public health, or some combination, or maybe this was isolated thing.
Okay, Bob, so I think your question is, you're hearing from either your viewers or anecdotally that there are individuals that who were tested positive and provided that notice, and they did not receive contact from contact tracers. Am I understanding that correct?
That's correct, yes.
Okay, we're going to have our lead epidemiologist, Kim Hernandez, respond.
Thank you.
Good morning, Bob. Thank you for the question. Part of it is many things. We have seen a significant rise in cases, as you all know, and we have allocated our workforce in order to put more people into contacting those cases and following up with them, as well as their close contacts. A couple of things have happened, in that interim as we were getting lab delays and information was not flowing to us as quickly as we would like, that there were some significant delays in reaching out to people. We continue to reach out to people today. We made a few alterations in response to people reaching out to us. There is now a page on our Kern County website where patients can submit their information to report some of the information we typically ask over the phone in order to make it a little bit more efficient on both ends, so they don't have to spend an hour of their time with us, but they can fill it out at their convenience, and our staff continue to respond to those. We continue to work with our healthcare providers to get accurate information, particularly phone numbers, in order to reach out to patients in our community to make sure that they are accurate. We recognize, with some of our healthcare providers is that we as patients sometimes forget to update that we've got a new cell phone, and so the information they send us may be for a number that they are no longer reachable at. So we do spend a lot of time trying to reach out to patients. We continue to have staff do that 7 days a week. We encourage patients, if they are waiting to hear from us, or if they have other questions, just general questions, to contact us at Public Health so we can help address some of their concerns.
You were trying to get up to 135 contact tracers, I believe, from 90. Have you made it to 135? Is that going to be sufficient, do you think?
Bob, I can't tell you off the top of my head if we're at exactly 135 at this point. We've definitely increased the number of staff we have working on it. We don't know if 135 is the magic number, if that will be the limit. We are trying to increase staffing in order to respond and prepare for additional cases, as well as make the entire process a little bit more efficient. We're hopeful with lab turnaround times improving over the last week or so that we will again be able to receive the information and respond a little bit more quickly than we have in the past few weeks. But we continue to encourage patients, if they're waiting to reach out to us, there are many times where we have been trying to reach them but have been unsuccessful. So we welcome that patients call us so that we can get started on the process with them.
Thank you.
Okay, the last outlet was channel 23. We couldn't hear you earlier. Tori, are you on the line?
She's having issues coming off mute, so she's trying.
Okay.
Can you hear me now?
We
Can you hear me now?
Yep, we can. Go ahead.
Okay. Whew. All right. I don't know what was going on. All right. Well, good morning, everyone. Thank you so much for answering all of our questions. We really appreciate it. And I definitely want to extend another thank you to the Director of Public Health, Matt Constantine, for meeting with me yesterday. I do have a follow-up question that came out of our discussion yesterday. He did say that this may be a question for Kim Hernandez, who is obviously the lead epidemiologist. So we're wondering, is Public Health 100% sure that no one is getting double counted? And if so, how?
Okay, we're definitely going to have Kim respond to that. Hold on one second.
Hi, Tori. 100% sure the answer would be no. We do get cases where we hear that their addresses are mismatched. They've been counted in another county, they were tested, and they're in another county, and we're still waiting for that information to flow through. So I'm not comfortable saying that we're 100% sure that we are not duplicating any cases. We do work very hard to make sure. We are double checking names with people who have multiple last names, hyphen, no space, as well as verifying with date of birth and addresses and phone numbers to make sure that we aren't double counting patients. We do know a number of positive patients, again, have positive tests. If they are retested in the course of their illness, those tests get counted into their original case. We don't recount that positive test as a new case in Kern County. So as much as we can catch those, we do. Obviously, some of those times, if they get missed and they get contacted again, they tell us they've already talked to us, and we reconcile their records. Because if you go to a different location at a different testing site, they send your information in that is slightly different. You can imagine how many people have very similar names, and many people do still have similar birth dates. So we work very hard to deduplicate them so we don't overcount cases.
So when you say reconcile records, just so that I'm clear here, so I can like understand this, not have to follow up. When you say reconcile records, would that be you guys retracting essentially a case from the dashboard?
So we're hopeful that we
Like
can
taking
catch
it-
it before it ends up on the dashboard. You know, when we recognize names or you have a very unfamiliar spelling of a name, we double check with healthcare providers, we double check with the patient to make sure that those do match or not. And so we are hopeful that that happens before it hits the dashboard. But there are times where we learn about it later, and then we do have to reconcile the information that shows up on our dashboard. Does
So
it help, Tori?
reconcile, just so we're clear, does mean that you guys take that case off and make sure that it's adjusted appropriately?
So if they were doubly counted and we merge those cases together, then it would fall off of the dashboard, the second iteration of that patient. So we wouldn't want to count that person twice because they are, as at this point in time, we're only counting the original infection that a person has with COVID-19.
Okay, I guess I'm just a little unclear. I'm just trying to see if like someone makes it to the dashboard and it's an unfortunate experience and then you guys take that person off the dashboard or not.
Yeah, Tori, we would remove them if we had to. We do all of these cross checks before they go to the dashboard. That's part of the reason our numbers don't always match with the state, because we're working to make sure that information is correct before it hits our local dashboard. The state doesn't wait for that reconciliation or for that double check that we do locally. They just post it the moment they get a positive lab result. So we're doing all of that on the back end before it goes to the dashboard so that we don't have to take them off or move them around what's on our local Kern County dashboard.
Awesome. All right. Well, thank you so much. I only had one other question, but if you don't have time, I totally understand. It was basically just to piggyback off of that, considering that we can't 100% say that, hey, you know, we aren't double counting people. I guess, what is your response to the businesses that say, why are we still on the monitoring list then? That's, mind you, I'm just a messenger. I'm trying to post these in the best way I can. And I'm just trying to make sure that we get the information that people in this community are hoping to get.
So we'll have Ryan respond, and then we're going to open it up to the follow-ups.
Hi, Tori. I'm going to try to, the data and duplication that you're asking about is not a reason we are on the state's monitoring list. The state's monitoring list is really focused on 3 areas. It's case rate, testing positivity rate, and hospitalization. Those are really the 3 areas of focus. I know today we're down below where we need to be on the hospitalization per the testing, but in the other 2 categories we're well high. The reporting out of these numbers, we had over 1,000 today and 1,800 yesterday, I believe, or the day before. So the answer to your question, the simple answer to your question is no. The duplication, or if that is happening, is not contributing to keeping us on the watch list.
Okay.
Thanks,
I
Ryan.
think it's more so, like, yeah, I'll let you guys go. Thank you.
Okay, so we'll open it up briefly for any last follow-up questions from the outlets.
JR from Kern Radio.
Go ahead.
Yes, it's in regards to the contact tracing. Who will be doing the contact tracing for the new federally run surge testing at the Kern County Fairgrounds? Is that going to be public health, and are they equipped to handle that kind of a caseload considering the backlog they're dealing with now?
JR, yes, that is handled by our local public health contact tracing team, and that's when Kim was talking about the staffing model that they're trying to find that's right for this. That's what they're talking about. So, yeah, we are, that does happen by our own team here.
Thank you.
Mm-hmm. Any other follow-up questions?
Can you hear me, Megan? It's Bob.
If there's
Yep, go ahead, Bob.
I'm interested in learning more about coordination with the state. It sounds like there's not a lot of coordination with the state. The strike team is going out kind of on its own, and I'm not sure how much they're communicating with the county. It sounds like not very much. Is that the ideal situation? Do you wish there was more communication and coordination with the state, or are you happy for them to kind of be the heavies while you be the educators? What do you think about that?
Bob, I think Ryan's going to respond to your question.
Hey, Bob. I think it's any time, certainly now, the relationship between governments, particularly local governments and state governments, or whether it's local, state, or federal, there's a bit of a gap, and coordination is not always where you want it to be. So yes, I think that there's always room for improvement, certainly in dealing with this pandemic and everything that's involved with it. We would like to see coordination improved, but it is this is a heck of a challenge for all of us. Super fluid. There's just lots of different things going on. It's incredibly complex. So we are communicating with the state. We would like more frequent and probably more quality and detailed communication, maybe more proactive communication from the state. But we are communicating with them, and the state, I just want to reiterate, the state has, the governor has a strike team because that's, the name he put on it and the announcement that he made, and that's the way they're planning, the narrative they're using to, make sure that folks are following the guidance. And again, they're focused on an education, communications-based approach to this. And it's been no different here in the county from day one. That is the position that we took. We are continuing to reinforce the guidance that's being provided by the state. We are going at great lengths to make sure our businesses are aware. We've had countless phone calls with large groups of a variety of industries here in Kern. We continue to do that. And again, our position is that we communicate to the best that we can with the state. Yes, always room for improvement. And we continue to have the position of making sure everybody's aware of what they need to be doing by order of the state. And I hope that answers your question, Bob. Does it?
Well, yes, but I would just add, do you wish you were empowered to do more? Maybe you are empowered to do more and have chosen not to, but I mean, the county also has tethers on local businesses. And I know the sheriff has said he's not interested in being the mask police, but we're number one now. Do we need to be the mask police, or do we need to be more aggressive in terms of enforcement in areas that the state so far has kept to themselves?
Well, yeah. Well, Bob, I'm just gonna try and be human here for a second. I mean, how do you be mask police? I mean, how do you do that? Virtually everywhere I go, and I know that there are exceptions to this. There may be one person in a Walmart that you see on social media, or two people, or wherever. But wherever I go, and I have to go out, obviously, we all have to go out and do things and grocery shop and other things. Virtually everywhere I go, every single person is wearing a mask. Everybody. Everywhere, virtually every business that I go to has signage on their door, and I thank you for that, asking people to wear a mask. And I see that happening everywhere. If you see somebody walking down the street by themselves that's not wearing a mask, that doesn't count. That the governor provides an exception for that. You don't have to wear a mask when you're out walking down your street when you're not around people. But folks that are frequenting businesses that are in and around other groups of people, everybody's wearing a mask. Now, how do you enforce a private residence who might have a dinner party with people and they're not wearing a mask? I don't know how you deal with that. So the position that we've staked out again is that we are saying that when you can't distance appropriately, and this is what the governor has said, you need to be wearing a mask. That is one part of a multi-pronged effort with washing your hands and sanitizing and distancing and staying home if you're sick and all these things. that are a set of best practices to help slow the spread, to manage the spread so that we don't overwhelm our hospitals. We continue to provide that message, and really that's the position that we have been in and we'll continue to be in as we go forward.
What about regulatory powers that the county might have in terms of permitting and so forth of businesses? I'm not really thinking so much about masks, but of businesses, going along with the plan.
So when we find out that a business is operating, whether we see it ourselves or it is one of the hundreds of calls that we get, these calls are of varying degrees and veracity, I can tell you. When we find out that there is a business that is operating outside of the guidelines, we communicate with them. They receive a letter. I'm sure many people that are listening and watching this now have received a letter. There were letters that went out early on, whether or not we thought you were in violation of the guidelines or not. But when you are in violation, there is contact made. When behavior change is not made, and we are aware of it, a subsequent communication is made. We go to great lengths to make sure that we're communicating the guidance to these businesses who are all struggling, and we're sensitive to that. But we're doing our best, and where communication fails at the end of the day, if a communication is made and multiple subsequent communications are made, even a visit from a local public health official who is investigating and providing the guidance, if that system fails, then we'll do what we can, everything we can, to get them into compliance. And part of that is this coordination that is expected by the state of counties. The counties receive a lot of state funding that flows through counties. The governor has said he will withhold large chunks of that funding for counties. This is critical funding that is needed, particularly during this time when we're running budget deficits. The expectation is that the counties are helping to reinforce the state's guidelines, and that the counties are expected to work with the state to help in that effort. And where local communication fails, and ultimately where state communication fails, I'm sure the state will act. They will act punitively. Again, there are a number of regulatory tethers to the various industries here in Kern County by the state. The governor was very careful, I'm sure, about putting together a strike team to cover the whole base of agencies that are involved with the various businesses that are subject to the restrictions. And so if you're continuing to operate outside the guidelines, you're doing so at the risk of your business. Some could argue that you're risking your business already because you're having to close down, and I get that. But if you're not complying with state guidance, you need to expect that you will be engaged by the state. And I'm not sure what they will do, but they have said that they're ready, they're here, they're watching, and they will engage. So our folks need to be aware of that. And Bob, I hope that answers your question.
It does, Ryan. Thank you.
Okay. Last opportunity for follow-ups. Anyone else? Okay, that will conclude our Thursday COVID-19 briefing. I want to thank you all for being here, and we will see you next week. Thank you.